today, again, this is the Fertility and the Black Experience, a discussion on race and fertility care. Today, I am amongst some phenomenal women, and we are excited to share our stories and how we kind of foster our lives around fertility. So first, I'd like to welcome Dr. Garvin, our fertility doctor here at Kind Body, Kirsten Kennard, who's our psychotherapist. We have April Christina, our IVF patient and advocate. And then we have here Reverend Dr. Stacy, who is the founder of CG. And then we have Sophie Salvatore, our employee advocate, and Carmia Marshall, who was and is our IVF patient and advocate. So a little bit about Kind Body. We are a new generation of health and fertility, and we pride ourselves and we specialize in modern practices and accessibility and full services in wellness, gynecology, and fertility. And for today's agenda, we're going to have like 3 sections. So the first section is going to be on clinical components of the fertility, which Cicely Garvin and Kirsten will be taking over. And then we're going to go into the socioeconomic barriers and how we overcome them. And then we're going to really deep dive into our own stories and have any questions that you may have for everyone on the panel. So I would like to pass the mic off to Cicely Garvin and Christine.
Good evening. And thank you so much to hear for that lovely introduction. Next slide, please.
So we are here to just really embody and express ourselves as a group of African American women. And we really want to just deep dive into how we take care of our bodies and what we do and all the disparities that came about. So as a group of persons of African descent, we get a lot of discrimination within the healthcare industry. And, you know, it's really unfair of how we've been treated, and from our ancestors to our families to just everything in between, we always feel like we've been defeated. So we really want to be able to connect with you guys and really share what it is to take care of your reproductive health. Next slide. Yes, so studies shown that Black women are 2 times likely to experience infertility than white women. As you guys may or may not know, this is something that's been happening for years. And when Black women attained access to reproductive treatment, they experienced the lower success rates compared to their white counterparts.
Great. Thank you so much, Tahir. I appreciate that. So I think, you know, let's kind of talk more about these disparities and what they really mean. These are not new disparities. We have known about these disparities for quite some time. These discussions that we're going to have this evening are not new discussions. Actually, these have been had for quite some time. And I'll tell you that Kind Body, as well as Dr. Edwards Dunn and other panelists on this call today, have had similar talks like this last year in July after we had the unfortunate murder of George Floyd. And we're continuing these talks, and we should continue these talks as we educate and empower women of color to seek fertility care. We talk about disparities, we know that there's poor outcomes, specifically when it comes to pregnancy rates, rates of implantation, which is the embryo sticking out of pregnancy, as well as increase in miscarriages rates. And I will tell you that as I reflected and prepared for this talk, I thought about my personal and my professional interactions with my patients regarding fertility, infertility, and fertility preservation. So many thoughts came to my mind. And the first and foremost were the misconceptions that women in our community have no problem becoming pregnant. In fact, as a resident, OB/GYN resident at Hopkins, we oftentimes made sure our patients were on birth control in these communities because we were afraid that if we didn't control their fertility, they would have too many babies. Furthermore, there's misconception that women who are in these communities do not need treatment, and they have fewer referrals for treatment for infertility services. And furthermore, I will tell you that many women in this community feel like this is a privilege to have fertility care, and it's not a privilege. Infertility is a medical condition, and there are treatment options available which should be accessible to all patients who desire to have these treatment options. It is my goal that through this and many more sessions like this, we are able to increase our voices and education about fertility and the Black experience, so our patients, our friends, and family members have access to education that they need to empower themselves and make decisions about their fertility reproduction. Let's get started. So when we talk about fertility reproduction, we talk about kind of these paths to parenthood. And I think everyone has an ideal path to parenthood. We're young. We think about, when we're going to grow up, we're going to meet that person and we're going to have a family with that person. But what happens if that doesn't happen? What happens if it doesn't happen on our time frame? Then what do? Well, ideally, we meet the person and we have natural conception, in which case we as fertility doctors have availability to be able to help you with optimizing fertility in that window. If for some reason you have trouble getting pregnant, we have options for that as well. Those options include things like ovulation induction, which is where we're able to give medications to increase the production of eggs and the release of eggs at the right time that the sperm is present. For some patients, that also includes insemination. And insemination means putting the sperm into the uterus at the right time. That can be with partner sperm or donor sperm in couples who either have low sperm counts or other sperm abnormalities, or in patients who are single by choice, desiring to use donor sperm for their conception. There's also options for IVF. This is in vitro fertilization, where we're able to stimulate ovaries to make many, many, many eggs, retrieve these eggs, combine them with sperm to make embryos, which can then be either frozen for preservation or placed into a uterus of choice to carry a pregnancy, whether that be the patient's own uterus, their partner's uterus, or a carrier of their choice. And we have additional options for family members for family building, which includes things like egg donation. Egg donation are patients who have given the opportunity for other people to build their families by providing eggs at a younger age to be used for patients who need them if they for some reason have lower ovarian reserve. Also, patients who do not have eggs within their relationships, whether that be same-sex couple, they are also eligible to use egg donors. And people who unfortunately have gone through what we call early loss of ovarian function, they also have availability to use egg donors. Sperm donors for the same situation, they can be used in patients where the couple does not have sperm in their couple, in their relationship. Also in situations when patients are choosing to be single by choice, or for some reason there was something going on in the male partner and they no longer have sperm that's available for reproduction. And then finally, carriers of pregnancy, which include gestational carriers. That's someone who's going to carry the pregnancy for a couple that desires to get pregnant. But I want to take a moment and say these are our options. But in families of color, these are not always options that we know about, that we access early. And I will also implore you to think about the fact that there are limited numbers of egg donors and sperm donors in these communities. And this is something that we must change. Well, it is all about the numbers, okay? And we know that as we age, we have all the eggs we're ever going to have at birth, and we either use them or we lose them. In fact, in our late 30s to early 40s, we know that we have only about 25% of the eggs we had at birth. And those limited number of eggs will continue to decline, such that by the age of 42, the chance of having a live baby from our own eggs becomes less than 5%. And As I always say, age is in fact more than a number. I think that we all enjoy the benefit of being able to age gracefully. However, as our eggs have been around since we have been born, these eggs have shown their age over time. And they show that age in decreasing quality. Egg quality means the ability of an egg to combine with the sperm so that we're able to have successful pregnancies. And we know that as we get older, when we get into late 30s, early 40s, quality becomes a driving factor for things like infertility, delaying an ability to get pregnant, increased risk of miscarriage, and abnormalities with babies in terms of genetic chromosomal problems. So we talked a lot about things that we know. And what I want to say is that this talk and many talks like this are really meant so that you can understand what the steps are involved in fertility evaluation. And the first step, I will tell you, is to take the first step. This can be the most daunting step. And it starts with just talking. Who do you talk to? Your friends, your family, people that you trust, your doctors that you trust. But I want you to know that you can also talk to us, your infertility specialist here at Kindbody. We offer fertility assessments, and those are just a time for us to meet with you. We can do that either virtually or in the clinic, and we talk to you. We not only talk to you, we hear you, and we see you. We see all the things that you've gone through, all the things that are contributing to your fertility and to your future planning for fertility. And I want you to know that during that talk, we're gathering information that we need to make the appropriate test so that we can ensure we have a good assessment of what your fertility is currently and for the future. The first test we do is actually going to be an ultrasound that goes in the vagina. We're able to then see the ovaries and with our eyes count how many follicles, the areas that eggs are contained, how many follicles you have growing in that month. We then combine that with a blood test, which tests for a hormone called anti-Mullerian hormone, or AMH. And together, the ultrasound and blood tests give us a good idea of what your ovarian reserve or egg supply looks like. And I often get the question, and I'm going to answer it now, when is it too early? When is it too late? And the answer is never to both of those. It's never too early to know what your fertility looks like, and it's never too late to know what your fertility looks like. So we talked a lot about the infertility in the community, but we didn't talk about what infertility really was. And I think it's important to understand it's a medical condition. Yes, it's not something that's nebulous. It actually has a very simple definition. It means that in a couple that's been trying to conceive with regular unprotected intercourse, if they're not able to conceive after a year with the female partner being less than 35, or after 6 months in female partners greater than age 35, that is the definition of infertility. And I would say that if you have any other underlying conditions, whether it be menstrual period irregularities, problems with your thyroid, problems with diabetes, problems with being overweight, any other medical condition that you have, you probably should be coming in to see us sooner for an assessment before we get down these long times of trying and getting the diagnosis of infertility. We're happy to see you sooner. I think it's important, we talk about disparities. We talk about all these things that exist and that are not known. They're not new. They're not new. Disparities are not new, right? They've been happening. And why have they been happening, right? We talked about these stereotypes, and we've talked about kind of this hypersexuality of the Black community, this hyperfertility of the Black community. We talk about biological factors, and two of the most common biological factors that we can test for and help to diagnose early on are fibroids and endometriosis. Fibroids are benign, smooth muscle cell growths that grow in the wall of the uterus, and they are very common. They are, in fact, even more common in communities of color. And I will tell you that not only are they more common in these communities, but they're more commonly found later in development and when they have an increased burden. And we know that when there's a fibroid in the uterus, you can imagine if you have a big ball of muscle going inside the uterus, where is there room for the baby to grow? Where is there room? There isn't. And so we want to evaluate with the ultrasound and see where your fibroids are. Are they something that we need to get evaluated with an ultrasound? Do we need to do other testing to see if the fibroids are in the cavity? Are they in the wall of the uterus? Are they very large? And are they causing you any problems? Are you having pain because of your fibroids? Do you have fibroids that are causing you to have heavy bleeding? These are all things we want to know because they can all affect your fertility in the future. And as I mentioned on the previous slide, I did give a small preview to the next one, which is endometriosis. And I'm going to just pause for a moment because endometriosis is a very common cause of pelvic pain. And I want to say the word pain again, because I think this is actually the highlight of the slide, is that pain in and of itself is often unheard and silenced in communities of color. And as I will tell you, endometriosis is one of the conditions that's actually not more common in communities of color. But it is more common to be diagnosed at later stages because it's often dismissed. The pain is often dismissed. The pain is often unheard, and the pain is often not properly diagnosed. I'll take a moment. April Christine is one of our patients, and she herself has endometriosis. And I want to ask you, April, if you join me in this discussion about your experience with being diagnosed with endometriosis and how you felt the community of medicine took care of you.
Thank you so much, Dr. Garvin. And hello, everyone. So I started my menstrual cycle when I was 9 years old. I was in the 3rd grade, trying to understand what a period is, sanitary pads, panty liners, like all of these things was foreign to me because in the 3rd grade, these are things we're not thinking about, right? So I had very, very, very bad periods all the time, heavy bleeding, nauseous, throwing up, back pain, leg pain, everything, you name it. And from 9 years old until my late 20s, when I finally became a healthcare professional and one of my patients happened to be an OBGYN, I had a conversation with her. And she was the one that unofficially diagnosed me with endometriosis. And then I completely left the practices that I was at before because I had leg pain so much to the point that I couldn't even drive. They kept thinking that I had blood clots. So I was going every 3 months for possible DVTs, making sure I didn't have a pulmonary embolism this whole time, not knowing that the pain in my legs was directly correlated to me having endometriosis. So I ended up having 2 surgeries. Both of them were 10 months apart. The second one was an excision surgery that was 7 hours long. I ended up finding out that my endo, we call it endo for short, had completely traveled all the way to my bowels. I had no clue because I was having regular bowel movements. I was urinating, like everything was totally fine. Other than the leg pain and me being nauseous, I would have never known. And then after that, now this year makes 9 years since my last excision surgery, but it was very, very trying. And to continuously go to a doctor thinking that you're going for one thing every 3 months to get evaluated. And I'm doing my due diligence from being a teenager all the way up into my early 20s to find out it was something totally opposite. I was put on birth control when I was 14. I wasn't even sexually active at all, but it was supposed to manage, you know, my blood flow every single month. And it did. And then my body realized that it didn't want it anymore. And then they changed me to another birth control and then changed me to another birth control. And I realized over time, and the reason why I became an advocate is that it was one, masking what was happening, because it's me taking the birth control every single day for so long, for over 10 years. It pretty much camouflaged everything else that was going on, that by the time I did my excision surgery, I was already at stage 4.
April, thank you for sharing your story. I think that, you know, part of this talk is the Black experience. And I will say that the Black experience is not one homogeneous experience, but we have a lot of shared stories and shared experiences that I think you highlighted so well, April. I just want to say, I'm sorry that it took so long for you to be diagnosed. I think that we do have to do better with diagnosing our patients sooner with things that are contributing to their health. And so
Absolutely.
Talk about the pain in your periods, but talk about your infertility, if you don't mind, sharing with us, what did endometriosis, how did that impact your fertility journey so far, if you don't mind?
Absolutely. So once I became an advocate, now I wanted to go to every doctor. I wanted to go to every specialist. I wanted second, third, fourth, fifth opinions if I had to, because I realized how important my body was. And not to say, my parents, my family, we didn't know anything. We wasn't educated about this. I didn't even know how to spell endometriosis, more so to even know that there were specialists out there. And then to understand the difference between, what procedure you should get over what procedures you shouldn't. And that was one thing where I have felt wrong at. But after my second excision surgery with my specialist, that was 7 hours long, I took it upon myself to go to a reproductive endocrinologist for my 30th birthday, just to really see what's going on, because I'm like, now it's a few years since my last surgery. I'm hitting 30, as a woman, once you hit 30, you start thinking of all of these things with your biological clock, and you want to make sure that everything is right. And at 30, everything was fine. My AMH was normal. I had so many follicles. I was like, great. Endo didn't get that side, And then when I got married 3 years ago, we enjoyed life and each other for a year. And then we decided that we wanted to conceive. So I went back to get my blood levels and everything checked again. And it wasn't what I thought it was when I was 30 years old. My AMH was extremely low. It was a 0.7, and I was devastated, devastated. And now at this point, I already knew what that meant. I knew that my follicle count was low. I didn't know what that looked like. So, my first fertility clinic that I had went to had suggested IUI. But for me, with having endometriosis, I had cysts and fibroids previously, with being undiagnosed for so long and knowing, the percentage rate of success as it pertains to IUI with IVF, I already knew that it was low. So I wasn't too happy with the fact that they wanted to do IUI. So, I asked her as an advocate, because now I'm not a patient. Now I'm an advocate, and I want to know what was her reasoning behind suggesting an IUI with my pre-existing condition and knowing what my AMH level is. And she honestly told me that she just thought that I would just get more for my buck with just trying for IUI.
But April, I think that's a valid point. How can she tell you what you are going to get for your money? It's really up to you to tell us what you need. And we decide together. April, let me ask you another question. You said that in your 30s you had a great AMH and a good follicle count. Did anyone talk to you about preserving your fertility, freezing your eggs, making embryos, planning for the future?
None of that. They just said that I was great and to make sure that I came back before I was 35. So being that I had no real knowledge of the fertility realm as it pertained to endo and fertility, and for me, my negligence and in my mindset, I'm like, okay, well, if my AMH is good, then I'm okay, because I've been, on the road to being holistic and, doing everything that the doctor ordered. So maybe that was helping. And in hindsight, I'm pretty sure that it did help. But if I look back on what I know now, I would have absolutely went through egg freezing. Absolutely. Without a doubt, without even second thinking, I would have done egg freezing. And then when God finally blessed me with my husband, then we would have been worrying about transfers. But that wasn't my story. And no one even told me that until I went to Kindbody and I started really looking through all of the different options that was available. Then I really started dissecting and understanding what it means, not only to have endometriosis, but to have endo and dealing with fertility struggles. And also, what does that look like for family planning in the future?
April, thank you for being so open. You're truly an inspiration. I think, you have really, really, really inspired other people in this group and myself to, be such an advocate for your patients. And I appreciate how honest and open you were for sharing your story. I know it's not easy because it hasn't been always the smoothest path for you, and you're still on this journey, but we're so glad that we're doing this with you and that you're doing it with us. And we're looking forward to hearing your success stories and a future talk, April.
Thank you. I appreciate it.
And the final one we mentioned is PCOS. PCOS, we know, stands for polycystic ovarian syndrome. It is the most common endocrine disorder of women that affects between 15% of reproductive age women. And it's characterized by either irregular periods, PCO, or many follicles in the ovaries, PCO appearing ovaries on ultrasound, and finally having an excess of male hormones. Those are the biological factors that I want you to consider when it comes to fertility. And behavioral factors. I think this is a very important slide to talk about, and I'm going to ask Kristen Kennard actually to join us in talking about this slide and talking about things related to diet and lifestyle and mental health. I think it's important to think about diet in terms of there's so much that we do in communities of color that influence our lifestyle and influence our health. Okay, and I think sometimes the communities of medicine can be exclusionary when it comes to communities of color in terms of diet. They don't understand the cultural influences that diet have on our lives. How do we eat? What do we eat? And how that impacts the ability of us to have social interactions with our family. It's always like decrease your calories. But how do you do that in a community where it's important? Family building and family meetings on Sundays are important in communities of color. How do you do that? How do you do that when you have a big family and you want to spend time with them? How do we lose weight? How do we continue to maintain our mental health during these times, Kristen?
Oh, and thanks so much, Cicely, Dr. Garvin. I think that there are a number of things that we can do as it relates to our behavioral risk factors. Many times, like you said, we don't consider how we eat, nutrition, not diet, but just nutrition in general and how important that is for childbearing. Not just when you become pregnant, but prior to starting really healthy habits in advance of, carrying a child. You want to begin that early to help with large families and things like that. You want to get everybody on the program. You want everyone to buy into the idea that good nutrition is important for all of us. So if you can get buy-in from your partner, from your family, that's really important. Another important lifestyle behavior would be exercise. I know a lot of times in my field, sometimes patients will say, well, I'm not able to exercise because I'm pregnant. Pregnancy does not prevent you from exercising unless you are having some very serious problems and your provider advises against it. But it's actually very good. Exercise is good for your mental health. It helps to reduce stress, anxiety, and even for some people who suffer from symptoms of depression, it's also very helpful in mitigating some of those symptoms. So to incorporate nutrition, exercise, self-care, which I'll talk about a little bit later, but rest is really important in the process of and just regular life and taking care of yourself. So whether you are struggling with fertility or not, these are things that are pretty universal. So but because if you happen to find yourself in this space and where you're struggling, it does matter how you care for yourself. The last one I mentioned, sleep. Most of us, we've become pretty resilient these days with going on less sleep, or so we think. Sleep is very essential to the body's rhythms and even your menstrual cycle. So for, let's say, women who are having fertility issues and you're already destabilized in that area, making sure that you're getting the appropriate rest is going to be helpful.
Thank you so much, Kristen.
You're welcome.
that is it for Kirsten and Dr.
Hey, Tahar, can you speak up a bit? We can't hear you.
Can you hear me now?
A little bit louder.
What about now?
Yes.
Okay, unfortunately, I can't hold the computer up like that. But yes, thank you so much for sharing that with us, guys. It was really, really impactful. I'm looking at the messages and I'm looking at the chat, and everyone is just so wowed by your experiences and what you guys have to offer. So thank you guys for really deep diving into what that looks like for us. You know, even with my own experience, I'm not triggered. I don't want to say it's triggered, but I'm very influenced and really intrigued by what's happening, because, you know, what happens in one Black woman's body happens in all of our bodies. As you say, like we don't take into consideration heritage and culture and community that, you know, has these effects on us. And I'm just so grateful that we can all be in this space, and Kindbody really is the force and the liaison between fertility and allowing us to see ourselves in these spaces. So I'm so happy that we have you guys here. So we just want to be able to improve access and care, right? Kindbody, look at it as the Soul Cycle or the Starbucks of fertility, right? We're moving into all these different spaces. We're becoming more and more around the United States, and we want you guys to feel comfortable. Even if you don't see yourself in these spaces, that doesn't mean you need to feel unempowered. You know, you want to speak up when you come into these spaces. I remember I went to my GYN just in August, and literally it was like a 10-minute conversation, and I was a little scared because I had so many questions about my fertility, but she told me everything was fine. And it wasn't until last week when I came in for a fertility assessment that I found out that I have slight PCOS. You know, I'm borderline pre-diabetic, and I'm just so wowed that I haven't had access to this type of information. If it wasn't for working at Kindbody, I wouldn't know about these things, or, you know, aligning myself with women who are impactful and deep dive themselves into these communities in the fertility community. So it's really important, and I can't stress it enough, how you need to speak up for yourself, your womb, your health, and everything that comes in between. Because with or without kids, like, you know, we birth so many different things as Black women, not just kids. So if we are focusing on birthing these ideas, these businesses, our family, and taking care of house, and we neglect our bodies, and we're unaware of these things, we'll never know. So I really want to advocate for everyone, and I want you guys to speak up, show up for yourselves, for your peers, for your allies, and really take care of your body. Next slide. Yes, so there's been such misconceptions and misinformation, like I've said, that we go through in these spaces. And a lot of why we don't show up for ourselves, like it says here, is cultural and religious beliefs. And we're just not seeing any representation in our care providers. I'm not sure where everyone's from, but I grew up in places like Claremont, Florida, which is in the middle of nowhere, but also grew up in Brooklyn, New York, where there is not one fertility anything in these, you know, these neighborhoods. So again, if you're not trying to seek these places, you'll just never know at all. I'm not sure what the comments are saying in the chat, but, you know, you really have to look for these places. And Kindbody is just something, I think that's a great place for everyone to kind of start on their journey to figuring it out, whether it's egg freezing, or if you already have a partner and you guys are looking to conceive, just really come in and check on the services that we provide. Next. Yes, so this disparities in the fertility treatments. I mean, it says 8% of Black women who seek help getting pregnant compared to the 15% of white women. Now, I'm not sure if you guys know the history of your mothers or your grandmothers and if you've heard their experiences. But when I spoke to my mother recently, she was so unaware. And I want to bring Kristen into this slide. But she was just so unaware of the things that she had wrong with her body, like the fibroids and the cysts, that she was just clueless, right? And that allowed me to be clueless. So when I went in for my assessment, I had to ask her all the questions. And Kirsten, if you want to just speak more on this, we can definitely dive into that.
Thanks, Tara. I think, and I do want to back up a slide a bit because I think it's something really important that we might want to talk about because you brought up the word history. And history has a lot to do with how we often find ourselves dealing with the type of disparities that we deal with, but also the lack of information, the idea that we don't seek care. A lot of that, just health disparities for Black people in general. We heard earlier, in minority populations, this isn't something new. So it's not something that we're surprised at hearing. It's just that the length of time that we've been dealing with this it's been a while. And so even as we're talking about fertility, it doesn't matter. Any of those things that we're talking about, Black people in general have been affected at enormous rates, whether it's heart disease, stroke, or anything. And now we're talking about fertility. And so Black women and even Black men, I don't want us to forget them as well. This is pretty women focused today, but men are also affected by this. Some of the disparities, and I just want to mention this because I think it's really important that we understand how we've even come to the time to discuss this and why there are these disparities. Why are Black women, why do we have more difficulty with child planning, family planning? And so there are remnants, if you will, of policy, governmental policy, state and federal policy that began way back in the 90s to limit the ability of poorer women, which happen to be mostly Black, to have their own families. So what did that look like? Black women are often discouraged, if you will, from having children, and their opportunities to have children were reduced by putting policies in place that put restrictions on women who receive welfare services, particularly cash services. And if they were to add to their families, they would be denied further assistance. So one of the terms I've heard used around that is fertility prevention as poverty prevention, if you will. So these are some of the things that help to bring along some of the disparities, right? And then also just the idea that the government could place a cap on your family. Now, we've heard about this in other countries, but not here in America. And so this is part of our history around this. Also, for women, we don't often talk about this as much as we should, and some of the disparities come about, and there's a lack of literacy around it because many times Black women are viewed as being fertile. Like we've heard from all of the professionals that you're born with a certain amount of eggs. You don't just happen to acquire some more at certain times of life or were able to produce more eggs. You get what you're going to get, right? So what we have to embrace as a community, as providers, is the idea around Black female fertility. We stand in the shadow of a history where women, found themselves years ago being enslaved. Men were enslaved. Men were considered breeders. Women were considered birthers. And among that, we also did the child care. We did the nursing. We did everything for women who were in the field, all the way to those who enslaved us. We cared for their children too. And so it's not uncommon in the Black community to hear stories of old where women were birthing 18, 19, 20 plus children. Those are real stories. And so when we wonder where some of these misconceptions, misinformation, even some of the disparities and things that are set up against us come from, is that we are always able to have children. Black women should not have that issue. And so it's just not true. So many people attribute the strength and the resilience of women who endured that. They attribute it to us, and that we, you know, and I keep saying us because I'm unapologetically Black, and I've had my own experiences with much of what we're talking about today. But I've also sat on the other side of this and at events and dinners and family gatherings where people will ask, when are the babies coming? And feel the shame and the stress of not being able to have an appropriate answer. And so I think it's important that we make sure we consider the experiences of our ancestors as well as those today, because it often results in just silencing the pain of infertility. And it leads to stigmatization, which can affect your mental health, as well as isolation, which affects your mental health for many women and their partners, which ultimately causes them to forgo seeking care. So I think here, when we talk about improving what we can do, this is a great time to bring in one of the greatest fertility advocates I know, who has been out there in the trenches and doing the work, Reverend Stacy Dunn. If she could just come in and help to address, you know, some of the educational gaps. If she can talk about, if you can, Stacy, about how fertility is affecting women, the different ways, and then some of the ways we can improve the access to care and also empower those who are in need of fertility services.
Thank you, Kristen. It's good to see everyone, and it's just such an honor to be here with you all tonight. I want to piggyback on something that you just stated, particularly this idea of the deep-rooted disparity and the issues that reflect to when we arrive to these yet to be United States of America, as well as the Caribbean, and how much of that, the trauma, the socialization, Black women, Black men, and the Black body being seen more as a commodity and for money rather than really being cared for. When we arrived here, the focus was that we needed to produce in order to care for the land. And if we could not produce, if we could not be fertile, then issues arrived. And so no one wanted to ever be seen as infertile. Yes, we hear about the stories of women at 15 and 16 having multiple children. But what we don't talk about and what we really don't hear about are the slave narratives that do talk about infertility, because no woman and no man wanted to be known as infertile because that meant harsh treatment.
Absolutely.
So talk about it.
When we begin to think about that and how that has created trauma and how it has also really become, I think it has become cellular trauma, right? Such that we today are dealing with the shame, not only of our current generation and our own personal shame, but we carry within the cellular being of who we are, the trauma, the trigger, and the trial of our ancestors that lived before us. And I think that part of improving fertility care and improving Black fertility care and Black reproductive health, the first step becomes our own education and deconstruction of our ideology around understanding our bodies, understanding that our bodies are beautiful, understanding that our bodies are valuable, understanding that we don't have to suffer in pain, and that, that we are worthy of being listened to and partnered with in the healthcare system and with our doctors. And so I think that becomes essential, that Black women and Black men understand that we are Black and beautiful, that we are caramel and captivating, that we are vanilla and vibrant, that we are beautiful, valuable, and powerful, and we are important at once. When we understand our value, then we can begin to move into spaces and have very different conversations with our doctors. We can begin to advocate for ourselves. We can begin to honor the fact that something hurts in our body, right? We can begin to say to doctors and fertility other than Kind Body, because we know Kind Body is doing the work, that, hey, why aren't Black and brown and Asian persons in your marketing and on your website? Why am I not seen? We can begin to stand up for ourselves and for each other. So I think when we begin to, one, start with education, we got to know who we are and know who we are first, right? And we got to begin to celebrate our bodies and understand that our reproductive health matters too. And so I think that's at the very foundation of the work that we have to do, and the work that we have to do even before we bring a miracle into the world. Right?
Absolutely.
So we can begin to care for the children that God will send our way. I also think that it becomes very, very important that we also make sure that the staffs of our fertility clinics, that they are culturally sensitive and that they are inclusive, right? We gotta make sure that we're seeing people, and we're not just seeing, when we talk about particularly African Americans, we shouldn't just see African Americans cleaning up bathrooms. We should see Black women and men and brown women and people of other ethnicities working at the desk. Doctors like Dr. Garvin, who are serving us. One thing we know from a research perspective is when Black women and men in particular, since this is about Black women and fertility and Black men and fertility, when we begin, and also because we have so much distrust in the medical system because of so much that has happened throughout our lives and that we have experienced. But research also shows this, that when we begin to interface with other doctors that look like us, that get us and fully understand us, what happens is that it helps us to begin to build our trust and also get the tools in our toolbox necessary to be able to navigate the spaces that we're in fertility clinics, and have the courage and the confidence to ask the right questions, and also help us to gain access and improve Black fertility care. So I think that these things can help us to improve access and also to improve care. In addition to that, I think that also what becomes important is making sure that we also are seeing people like Dr. Kristen, so it becomes imperative that we understand that our journey in our life is a lifestyle, right? And so as we're walking on our fertility journey, we have to make sure that we're meeting the needs of the totality of our being, our spiritual being, our mental and emotional being, and that we have the necessary support that we need to share about everything that's going on in our life and on our journey with other people that get it and who are not going to critique us or judge us on the journey. And that's why I founded Fertility for Color Girls, because there was no place like Fertility for Color Girls, and still is not like Fertility for Color Girls. The organization that I say is the Black organization, the infertility organization, the national organization. I'm not going to say a national, I say the national organization for Black women and couples struggling with infertility and loss. We birthed Fertility for Color Girls on March 8th of 2013. At that time, I was in my own 6-year journey of infertility. I had just completed my 6th in vitro cycle. And I was devastated because I had 5 unsuccessful. The 6th one was successful and I lost the baby, but I was absolutely devastated. But one of the things I found on that journey, that there was no place where I had the opportunity to engage with women that looked like me, understood my experiences on the journey, that was not going to judge me or critique me. I couldn't find it in my church. I couldn't find it in my community. I couldn't find it amongst my girlfriends. And so God said, you started. And so I started that organization in 2013. We have locations, 14 locations all over the country, and soon 16 locations as we're geared to open up in Louisville and Jacksonville, Florida. Our organization is making great strides. But one of the things at the core of who we are, that we seek to make sure that women understand, as I saw in the chat, some sister said, I feel so alone. Infertility can be lonely, but what I want you to know today is that you are not alone. We do see you. Kind Body sees you. Fertility for Colored Girls, we see you. And there is a village of women, particularly in the organization that I serve, that is here to support you, walk with you, and be with you on this journey. It's one thing that they say, particularly about when Black women come together. When Black women come together, there is a sacrality that occurs amongst us as we conjure together. This sense of sacred space that is free, that is liberating. And then when we begin to share our stories and we begin to resonate with each other, like Tahira said, we begin to understand that we are our sisters. Not only are we our sister's keeper, but we are our sister. And then we are able to to hold up each other's arms as we walk this journey and say to each other that I am with you. I'm cheering you on, sis. I'm here to cry with you. I'm here to walk with you. I'm here to encourage you. And I'm here to hope with you until you discern the path that God has assigned you to become a parent. And I think that these sacred spaces, such as Fertility for Colored Girls, where women come together to gather, to share their stories, it becomes healing, it becomes inspiring, and it will give you hope to be able to understand that if God has done it for your sister, God can do it for you. And so I think that is the purpose for me for Fertility for Colored Girls. I think those are the ways that we can seek to increase access to care and also to improve Black fertility care. I hope that answered it.
You've answered more than the question, Reverend Stacy. I just want to say amen to that. Everything from all the way from, speaking to the commoditization of the Black body, all the way to how beautiful we should be seeing ourselves and how worthy we are of children and the appropriate care, and that everything should be inclusive on our behalf. I say amen to that. And I thank you so much for sharing that information. I just want to say too, along that line, that I'm very pleased to be a part of what Kind Body is doing from a mental health perspective. I'm really glad to be a part of the initiative that they've put in place to begin implementing mental health assessments as a standard of care into their intake process. Just can't say enough about how important it is to make sure that we are coordinating care on every level. So we are not just physical, but we're emotional and mental and all of the other things there. And so I think it's important, especially for people who are considering treatment and services, that it be really important that these things are in place. I'd like to just piggyback a little back to April, just to ask her a quick question about how she managed, April, how you managed your emotional well-being during your fertility preservation process.
Oh, that's a heavy question. One, I always love being around Reverend Stacy because although I'm here as an advocate, I'm still a patient too. So I'm like, Reverend Stacy, I just love you. But to get back onto what you had said, emotionally, the journey is tough. Like I'm not even gonna lie. Like the first day when we started our stimulation, the medication, I literally got nervous. Like I was shaking, my palms were sweaty. Like I was like a nervous wreck because I did not know what to expect when you're going into starting a cycle. It's literally the unknown. And my husband was like, "Are you okay? You know, like we don't have to do this. Like, if you want to do this, we can move forward. If you don't, then it's okay." And I think like the reassurance and the satisfaction of having my husband around 200% helped me through the process. Also, the fertility community has been absolutely amazing, but I think more so for myself, growing up as a PK, when I first found out that I had to go through IVF, my whole world like rocked. Because, you know, growing up as a PK, as a preacher's kid, you're just like, you know, well, God gonna do it. And, you know, he's going to make a way. And then my mindset had to really shift and understand that God created science. God created Dr. Brown, my doctor. God created my nurse. God created Kindbody. And there were so many amazing things that took place that I had to seize the actual moment of actually getting to the point of getting to this journey to conception. And once I really understood within my heart, and with praying and with talking with my husband and with other people in the community that has already been through it and currently going through it, that really actually helped me. I think that sometimes we isolate our thoughts in our mind as if we don't know what's already happening. And with me being someone that's a faith believer without also understanding that God already knows that this is something that I was going to have to go through, and that this is a journey that I was going to have to take, and that I was strong enough to be able to endure whatever it is. One thing that I will say that pivoted me also was having my initial assessment conversation virtually with Dr. Brown. And she was like, "No, we're going to do IVF, and it may not happen on the first time, but we're going to get through this." I think it is the relationship that you have with your fertility doctor that really helps pave the foundation for you to understand. Obviously, it's, you know, it's disappointing and, you know, nerve-wracking when you go through the journey and constantly going for monitoring, because in your mind, you're like, no, these already grew to over 10. Like, I'm not gonna have to go through these full 14 days. But, you know, in hindsight, it's, you know, the reassurance of understanding that it's a journey. And it's something that I say all the time to people that ask me how I go through it. And it's your pace, your race. I can't compare anything else to what anybody else is going through, because everyone's experience is totally different than mine. But I know that the journey and the path that I'm on is going to lead me to what my husband and I desire, and that's to expand our family and to have children.
Right. Thanks for that, April. I know what really stands out to me for that is you just explaining, and I think it's important, especially among the faith community and even culturally, that seeking this kind of help for yourself is not an indictment on your faith. It doesn't mean you don't pray enough. It doesn't mean God doesn't love you. It doesn't mean any of those things. It just means that it is what it is. And like you said, for you and your partner came to an understanding that this is what God knew we'd have to go this way. So I thank you for saying that. And I also just want to say lastly, especially for women, couples who are seeking the kind of services that Kindbody offers, is that you include your provider in that process. If you have a system of belief or cultural traditions that matter to you, it is important that you express that to your provider and let them know, I'd like to let you know that this is where I am, because this is also how we cope emotionally. So it's important to share that information with your provider and let them know, hey, I just like, it's not so much that they have to pray with you, because I know some providers feel concerned about bringing that, being involved on that level with their patients. It's totally up to a provider. But it's just the fact that you let them know and that they can partner with you and be a support for your incorporating that into the process on whatever terms you need to do it. But bring them in so they understand that. And then also, allow you to have your way in that space, if you will, as you're going through that journey. I think that's really important.
You so much. I kind of want to circle back to Carmia, and I would love for you to just speak on your background on the grant and your journey into fertility.
Hi, everyone. Thanks for having me. I have to say that I'm cycling right now, and I am the winner of the Fertility for Colored Girls grant. Reverend Stacy and Jennifer Woods from Kind Body awarded me this unexpected grant on Veterans Day. And I'm sorry if I get emotional, but all of this talk about fertility and family building and us working together to make everyone know that it's not too late and to access our resources is making me very emotional. But I would say when I was awarded the grant that day, I remember when I was applying for it, sitting here thinking about family building. And I said, if I win this grant, I'm gonna take it as a sign to God to make family building a priority. And I am an entertainment worker, and COVID hit and I was unemployed for about 8 months. And my husband and I had started our fertility journey, but everything shut down. And while we were not hopeless, we were put on pause. And so when I won this grant and when we run this grant, everything changed. I felt time literally stop in place and say, this is it. Now's the time. And I feel very grateful for a friend who emailed me the application. And as I was really reading about the organization and what Fertility for Colored Girls and what Kind Body was doing, outside of whether I won the grant or not, I was so overwhelmed and I had so much admiration for what was happening, giving women, people of color, women of color, an opportunity at motherhood with this grant, because we all know that it is expensive. And if you're not planning for something like this, it can be a deterrent for you to pursue your family goals. And I mean, words cannot express the level of gratitude for the work that is happening and the education that is happening within this community. And I started my cycle on International Women's Day, yes, March the 8th. And I'm very close to triggering. And I just have learned in this process to trust God, to swallow the fear, and to push forward. And I'm 44 years young, and I know what the statistics say, but I'm happy to be here. And I feel like I should, and my family, we deserve a chance to build our families. And it's been an intense process because it's very hard to stay calm because you want to have a family so bad. But at the end of the day, you have to trust the experts. You have to trust God. You have to lean on your family and your friends. It has provoked conversations with my friends and family that I never had before, as far as talking about asking for help, seeking resources, making family building and planning a part of a normal everyday conversation to say, hey, have you thought about building a family, but not in a way that's full of pressure or expectation, but just in a way where you could talk about what you want and pursue it. And so it's amazing. Kind Body has been great. From the first day I walked into the space, everyone it's bright, it's beautiful, it's warm, it's fuzzy. The bedside manner is awesome. And I am also a person that I have PCOS, and I didn't really, I wasn't officially diagnosed with that condition until after I was over 40 years old. Not officially. No other OBGYN, no other GYN had told me what my actual condition was. And I always suffered from talking to doctors and the bedside manner. I always felt like I was rushed. And at the time, because of a lack of education or just not knowing, you don't know what questions to really ask about what's happening with your body. So it takes a little time to learn about the things that are happening to your body so that you can properly advocate for yourself if you feel like your medical professional is not advocating for you. So that's what I love about this, Fertility for Colored Girls and Kind Body. And also the community of women that I've met through this process. We're texting with each other. We're sending each other's positive quotations. We're saying, you got this, you can do this. We're supporting each other. We're leaning on each other. We're crying, we're laughing. We're doing all of those things. And it's actually a community that I didn't even know I needed until I was a part of it. And so for that, I am forever grateful. I am forever grateful. And now as I continue my journey, as I'm very close to triggering, I'm going to scream about this to everybody I know so that this conversation that we're having is normal. I'm not ashamed. I'm not scared.
We are swallowing and screaming. I know that's right.
Yes, we're telling everybody that it's okay. We got this. There are solutions for problems if we seek them. And that's what I plan to do. And so had I not been a recipient of this grant, maybe I would not be doing this. Maybe I wouldn't have not made it a priority, but it was such a smack in the face. Like, you just realize that family is important, especially because I am a career-driven woman. I'm a freelancer, so schedules are, and you just going from gig to gig to gig to gig to gig, and next thing you know, all this time has passed, and you forget to think about the things that matter most, which is family. Yeah. And so I've had a realization or an aha moment in all of those facets that I'm just gonna scream about fertility. I'm not gonna be ashamed for what I'm going through. My husband, who's been so supportive and loving, and my family and friends, I have to give myself injections sometimes at work, who are there with me on this journey to make sure that this family building that we're doing will be successful. And I want to share with all the other women who want to do this, and men too, who suffer silently in their infidelity as well, that we're here for each other. There's opportunities for us to build our families, and we can't be afraid to speak. And we're not alone. I am not alone. There's someone else that is sharing my experience. And all of our experiences are unique and special, and we can learn from each other. We can be each other's biggest cheerleaders. And so, Reverend Stacy, thank you. Kind Body. Thank you, because this is a dream. And it feels like it just came out of nowhere. And so I'm just overwhelmed with joy for all of it, for the process, for the education, for the community, the support, and for making people aware that
Thank you so much, Carmina. That means a lot to us. Your story is so impactful. The chat is going nuts. And I want to cry, but I'm going to wait, thug it out until after.
No, I'm a crier. Reverend Stacy knows I will cry.
Guys, before we wrap it up into questions, I want to touch base with Sophia. So, Sophia, are you there?
Yep, I'm here. Hello.
Let's talk.
Awesome. Well, I'm really excited to be here and hearing what everyone has shared. I've definitely seen and heard a lot of my experience as well. I'm a woman who had unexplained infertility for many years, went to a specialist, not Kind Body, unfortunately, and was undiagnosed and had a polypectomy. And I work with over 55 high-tech employers, specifically in the benefit space, and that includes fertility and time off. And so I have a personal passion and also a professional passion. And so I'm really excited to just share some tips about navigating care, because I think that's something that, regardless of where you are in the beginning stages and the after stages, if you're triggering, if you're not, if you're thinking about it, taking time for yourself and honoring your physical health and your emotional health is going to be consistent, regardless of what your family looks like or how it gets formed. And so If you have access to employer benefits, I would say my number one tip, and also this is also a retrospective because I do have 2 children now, and these are things that I wish that I had known. Even as a benefits professional, I did not do these things. So this is kind of the space that this is coming from. So the first one is, on the employer benefit side, if you have an employer that offers benefits and time off, read through the policy, get to learn about it, understand it, ask questions. No is the beginning of the conversation, right? So if your employer policy is like, we only give you 5 vacation days, but you need an extra day because you're going to go to an IUI. Like, I went to all of my IUIs by myself. I drove myself. I cried in the car by myself. I laid there on the table by myself, right? I did not take time off to respect my body, to respect the experience I was going through, and to really take a moment to take it in. I remember the moment that I did, and I was like, why is no one here with me? Obviously, it wasn't COVID time where, there's some limitations, but that's why it matters. And so read about the policy, and depending on the state or even the municipality you live in, you are going to also have some other opportunities within your local city to learn about other policies, especially because of COVID. Additional time off and state disability policies are passing at both the state and city levels. And so the one thing I think about is you want to know how you get paid and how your job is protected. Those are 2 separate things. And you want to think about that and kind of map out how you want to spend your time. Like, you don't know necessarily, like when I was on the journey, I remember having this big question mark over my head and not knowing. I actually was silent. I didn't talk about it. I told people I'm not having kids. And I wish that I had taken a second to just map out some possibilities of, if I was going to experience this, whether I talked about it or not, what are the tools that I needed? And so one of them for me is, in retrospect, I wish that I had taken more mental health days. Call it what you want. You call it a sick day, call it whatever you need. And that is really, really important. And so the other thing is, understand the culture that you're operating in, whether you have an employer or whether you are a freelancer, or whether you are getting help from your community, your friends, your church. Talk to the people who support you and ask them what they need to support you, right? Like, think about the care that you would give to somebody else and then apply it to yourself. And so another tip would be, if you have a partner who's eligible for benefits, talk to them about their benefits, get them to send you the link, give you the brochure. And that's a part of engaging in care. And if there's someone who, say, is going to drive you, like, talk to them about that, form your community, and don't undercut yourself or underrate the value of what you're experiencing. It's really my biggest regret and what I experience.
Thank you so much for that, and for your story and sharing that. It just really seems like we're all in a reflection of each other at this point. But I do want to say thank you to everyone that has shared their story so far. And I really want to get into questions as we are running a little bit behind. So I have a question for the audience. Or do we need to get into prices first, actually? So at Kindbody, we're just really here to improve access and care to you guys. Again, we want to be this new modern lifestyle that we've created for you to feel comfortable and to feel seen. And as you see, we have amazing advocates at Kindbody that will lead you in the right direction. You have me, you have Hina, who's in the chat, who's been such great help to a lot of the patients here. And we just really want to create a safe space, whether it's for anything within fertility, wellness. If you even need a girlfriend to just chat to, a lot of the women come in and be like, hey girl, and they find out so much about their bodies by just asking like little simple questions. We want to make it super comfortable for you guys as we are growing and expanding. So next slide. So we accept all major insurances as long as it's PPO. So please check that out with your insurance company if you have fertility benefits. And also be an advocate for your body by going to your employer and asking them as well, like, hey, do you guys support us? Do you support fertility? Just because a lot of them don't. And how would they know if you're not advocating for your body? So please take the time out to learn if your insurance providers have or if we take any, well, we take any of these, but if your insurance provider doesn't work with fertility, please be an advocate for yourself. And yes, the best part of it all, we are giving out a special code to every single one of you today for the fertility assessments, the egg freezing cycles, and the IVF cycles, as you can see here. And this is without the copay, but we're giving half off. So please take advantage, screenshot this, contact me, DM me, email me, anything. If you are having trouble with this, but please sign up at kindbody.com. Or if you have any other questions, you can email us right there at the navigator at kindbody. But I'm more than welcome and happy to be that safe space if you have any further questions before really diving into this. Next. And yes, the best part, the part that I've been waiting for all night to hear from everyone and to really get those questions answered by everyone on the panel. So I will start with the first question, and that is, from your perspective, can we take this, can we not share the screen or this slideshow anymore? I want to see everyone. From your perspective, what can we do to improve access and care, and what's missing, and what can we do better? Now, this is open for the floor, so please unmute yourself, tell us where you're from, who you are, why you're here. We love you. I can repeat the question again. From your perspective, what can we do to improve access and care? What's missing, and what can we do better here at Kindbody? And you're more than welcome to just say it out loud because you're Black and you're proud. Anyone?
Thank you. I was trying to unmute myself. Hello, if everybody can hear me. I am Marissa from Southern California, representing SoCal. I live in a predominantly Black community. So I live in the Crenshaw district. I don't like to call it South LA because it's not South LA to me, because people want to have those stigmas of South LA. It's Crenshaw district, okay? I'm from Crenshaw Boulevard and MLK. So what I do appreciate is that you guys have, there's an opening of Kindbody in Redondo Beach area. But if you guys, and I'm sorry, I thought I had my earpiece in. If you guys can have options and locations more within the scope of areas that are more culturally dense for people of color, such as in my area, we have the Crenshaw district. So you have Inglewood, you have Hawthorne, you have Carson. Redondo Beach is great, but that may not have access via public transportation for people who are more in the inner cities and those such. I mean, I know I'm 40 years old. I thought I was going to be married with babies after I finished undergrad. That was some years ago. But there's no stigma there. It's just, as we have all spoke about, you thought you already had this preconceived notion of where you were going to be in your journey. And so I thought that was going to be in my journey. But what's great is that I do have this option. And I have spoken with my other friends as girls who we've spoken like, yeah, I just have to think about that now. So I'm grateful to have that. But we also know it is not, it can be expensive, and you have to save up money and everything for that. So I know it may not be as cost effective, and I saw your prices, they are. But just that, I'm just thinking about that, just to have the reach for more of inner city, if you will, and probably have some type of relationships with some of the providers that are already providing those clinics to the inner cities, have that probably option connection with those, because that can be an extension to possibly those inner city clinics that are already in the community as well. That's just a thought.
Yeah, I mean, you're onto something. One, I think we are in those stages of really growing and expanding. Like right now, we're opening up in Atlanta, where Dr. Garvin's going to be leading, which that's super exciting. And then we have a few locations in California. We're opening up in Texas, and I believe we are. I don't know if I'm allowed to announce this actually, so I should scale back. But I know for what you're trying to say of like we should like link with doctors and other providers and really have this as a service. Stay tuned. We can't hear you, Marissa. We can't hear you, Marissa. Okay. Does anyone else want to add on to that, or we're going to move on to the next question? 5, 4, 3, 2, 1. Okay. To Dr. Garvin, why is it important that we discuss racial disparities in fertility and fertility care?
I think that's a great question. I think it's important because it is important. I think that's actually the answer to that question. And so, as you know, Kristen and Dr. Edwards Dunn and so Sophie and Carmia and even you have mentioned, you know, Black reproduction actually matters. And so I think it starts there. And it's important to have education that we can share with our friends. This has been a great group. But as Marissa mentioned, you know, we have to reach people even out of these spaces. And so, you know, if they're not here in Kind Body, which we're in Century City and we're also in Santa Monica, but you can take this information that you have and share it with your friends, share it with your family. Please, let's educate. I don't want the next 10 years to be having these same discussions about disparities. We have to stop the cycle of having discussions over and over and over again about things that are not new and start making changes, which starts with education, education, education.
Thank you for that. Before we go on to the next question, Carmia does have to leave. Carmia, thank you so much for sharing your story with us. We really appreciate you, and I hope I get to meet you soon. Good luck with everything. I'm so excited to follow your journey. Thank you. We appreciate you.
Thank you. Speak soon. Bye.
Alrighty. Bye. So I do have another question for you, Cicely. What information is important for Black women to understand when it comes to their fertility? And in your opinion, what is Kind Body doing to prioritize the care of Black women to make fertility options more accessible and welcoming?
We went over some of those questions kind of earlier in terms of what you need to know. You need to know your egg count, your egg numbers. You need to know your general health. You need to know about your other factors that can be contributing to fertility. You need to know about your mental health. Do you have anxiety? Do you have depression? If so, what resources are available for you to take care of your mental health? You need to know about your partner's health. You need to know about options for even if you don't have a partner. You need to know about all the options if you're transgender and you're going to undergo gender affirming surgery. Options available for you then. If you have cancer, if you have sickle cell, what are your options? You need to know all your options. You discuss them very early and discuss them often. Circle back to your options. Don't take the answer no. I think Sophie said no. It's just the beginning, right? If someone tells you no, ask somebody else. If someone tells you no, ask somebody else. Seek several opinions when it comes to your fertility care. And I think Kind Body does a good job of it being accessible to patients. We do these talks, we have virtual connections, and I think we are also incorporating things like Kristen and Dr. Edwards Dunn in our model, where we are getting fertility services in addition to your religious services, in addition to your mental health services. It's all very important and it's all included. And Kind Body is working to be as inclusive as possible in the care that we provide to our patients.
Yeah, I know that's right. Period. Alrighty. Thank you, Dr. Garvin. To April and Sophie, are you guys still here? I have a question for you guys. Why is it important for patients, women, to advocate for themselves? And why is it important for doctors to be transparent with patients before embarking on their fertility journey? And that was for Sophie and April.
Go ahead, April.
Okay. So I had mentioned previously with Dr. Brown, and she is my reproductive endocrinologist in the Kind Body New York City location. And her honesty and love, let me say that, because there are physicians that are honest and you leave out there snot nosing and trying to find another location. But her honesty and gentle care with actually explaining everything and just really keeping it 100% with my husband and I is what really propelled me to feel comfortable and to continue to ask more questions so that if someone else asks me a question, I'm more educated and more knowledgeable in that area. So telling me like, this is going to be a journey, but we're going to tackle this head on, and you may have to do more than one cycle, but I'm going to be with you to the end. It's the reassurance, but also the realness, because you need to have both of those hand in hand, because I think, being unrealistic and also taking away and leading a patient on can be detrimental emotionally, and also with something as sensitive as going through fertility treatment, deter them from wanting to continue forward, because it's already, a struggle and a journey to even get to the point of actually showing up to one appointment, more or less going to one every other day for the next 10 to 16 days before, you actually do your retrieval. So I think that is one aspect as it pertains to the physician and just being honest. For me, I love to have relationships with my physicians, which is why I don't mind getting second and third opinions, because I want to feel 200% comfortable to be able to explain my fears, my reservations, as well as, praising the, amazing times, as well as the low points, and how we can improve to move forward to whatever that next may be. As far as the advocate part, I think that actually showing up for yourself, and this is something that I realized early on in my journey with endo and now with infertility, is just really showing up for myself and being present, and in one time is already being an advocate, right? Because you can have the knowledge and know what you're facing, what you're up against, and you can leave and go home and continue to chill and have a good time and travel and do whatever other things you want to do to cloud your mind from the actual reality of what's taking place and what's happening. So I think actually showing up and being present to every single appointment and asking questions is advocating for yourself. I think going for a second opinion and not being afraid, actually trusting your gut of what's actually taking place and what your actual reality is actually advocating for yourself. And I think another piece, the third part, is actually taking rest. I think that people, fail to realize that other aspect, because, when you're thinking about your age and you see your numbers and, what you're faced against, you're like, I have to go, 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 go. And then you reach a decline and you don't know what happened because you're being so active and you're doing everything that you need to do, but your body also needs to replenish. You also need to feed your emotional part, your soul, before you're able to take that next hurdle to go over whatever that next is for you. So I think, like I said, just being present, actually asking questions, and resting are the three main things for me that I mix together that helps with my advocacy. And it allows me to keep moving forward because, like I said earlier, I'm still human. So I'm like knee deep into this journey still. And, I don't mind sharing my journey because I went undiagnosed for so long. And I don't mind sharing my journey with fertility because I want African-American women or any other women of color to not be ashamed and afraid. But at the same time, I also know that I need to give myself grace and I need to take time and I need to enjoy the things that I need to enjoy. And when I have that, that feeds me and I'm able to pick myself back up and to continue to advocate for myself and for others.
I hear that. I hear that so much. It's so important. And I love that you said rest is something that you really take into consideration because, as Black and brown women, we're always on go. And that's how I started the conversation. Like, even though we're not actually giving birth physically, we're birthing so many things in our lives that we neglect our body and our rest. I think,
and this is a part of the process to get to the purpose and the promise and the journey that you want. Like all of these things come together. And, you know, sometimes in hindsight, because you're looking at all of the things that you have to do, you forget that, you know, the momentum of how you start and, you know, the breaks that you take, and then continuing to go back, and the conversations that you have, the people that you have in your circle while you're going through this, all of these things help to make the journey and the promise, and you expand your family. All of these things you have to take all into consideration. They all go hand in hand.
It literally takes a village before you create the village.
Yes.
Right? And that support is definitely needed. And I kind of want to just segue into the next question. And this is for Reverend Stacy. What more can we all be doing to elevate Black stories and destigmatize care with support?
I believe, you know, we have to continue holding and having programs like this. But I also think, and not but, because that negates everything I just said, and for every person that is on here, it becomes imperative that we too become ambassadors of this message, and that we break the silence around Black women and infertility and reproductive health. And we share with people that it is a diagnosis. It is not a death sentence, right? It's a diagnosis and not a death sentence. And there is an ultimate destination in mind for each and every one of us. And so I think that that's part of it. We have to share our truth. We have to be authentic. As April Christina said, we have to show up. I'm sorry about my 6-year-old screaming in the back. That's part of Zoom life. Like, when are you going to be finished? But I think that we have to show up and we have to share our truth. When we find ourselves in doctor's office and we don't feel like we are being treated rightly, we have to speak our truth. If something, you know, we have to advocate for ourselves. We have to ask questions. We, you know, and we, you know, and so we have to be willing to call people on the carpet. Again, we have to be advocates. We have to be ambassadors. And the more we tell our stories, the more healing we will see take place. The more people we, you know, will feel supported and they will experience healing. And the more we will be able to tear down these walls of shame and demystify. I was thinking earlier, and I want to say this, and I'm gonna turn off before my daughter turns it out. I was thinking earlier when we were talking, you know, spirituality is so important to particularly women of color, whether you believe in God or a creator or whatever divine being. I just think that it's so important that we also realize when we're walking this journey is that so many times we're often looking for answers and we find ourselves blaming God for what's happening or our creator or, you know, our divine being or for what's not happening. And part of our responsibility in our relationship with God or whoever our supreme being is that on this journey, we are called to draw nearer to God and experience God in deeper ways. And it's not God's responsibility to do all of this by God's self. God has already done a whole lot of things, but it's our responsibility to be co-creators with God in the process. And we learn how to be co-creators with God and discern what God wants for us by drawing near to God to hear what God is seeking to do in our lives. And so we have to swallow our fear and we have to have faith and we have to have hope. My girlfriend, my line sister just said this week, hope is faith reaching your hands out into the dark. For faith is the substance of things hoped for, the evidence of things not seen. Sisters, hold your hands out in the dark and watch God light up your situation and show you the way. I believe this is how we destigmatize and we demystify our situation, particularly around Black women and fertility.
Yes, yes, yes to all of that. Oh my gosh. I'm about to cry. And I think this is why this is just so important. Again, like I didn't come onto this journey into fertility until recently, but learning about my body through my spirituality, the closer I've become to God, to the universe, or whatever my practices were, I really try to self-heal myself through the learnings that I've had in the heritage that I've, inherited. And it's just really, we can only do so much. God can only do so much, like Stacy says. Like, we actually have to do the work. He gives us the tools and the knowledge, and it takes us to really guide ourselves and lead ourselves into these spaces. And I'm just so really grateful. I'm just really grateful for this. I don't want to cry. I have a question for Kristen, and then we're going to open it up to the floor. Mm-hmm. One unfiltered takeaway that you would like the audience to leave about how to stay healthy emotionally and physically during this journey.
Okay, well, that's easy to hear. I mentioned it before. One of the most important things that you can do for yourself is engaging in good self-care. You do not have to be a martyr or the Lone Ranger in this process. Good self-care. So again, that's good nutrition, good exercise, getting sleep, rest, as you and April mentioned. But I also want to say, build in some fun. Like, this process can be work. And if it's not work, again, physically, it's work emotionally and mentally. So be sure for yourself as well as your partner, it's okay to have a good time in this process. Give yourself permission to enjoy other things, and definitely to, share and engage in activities with your partner. Partner relationship quality is really important. So take care of that. And then also under self-care, I would say social support, okay? Build in the right family, the right friends that can support you. You lean on and lean into your spiritual and sacred spaces that support you. They're there for you. And then definitely create the best relationship that you can with your provider through the process.
Yeah. Go ahead.
Oh, sorry, I wanted to circle back to the other comment around advocacy and the value of it. I'm sorry to interrupt. I also wanted to highlight that the advocacy work that happens now, the unlearning of the silence of not asking questions, that is a lifetime journey, and it will continue forever. And so a lot of the tools and resources that this community is developing will be impactful throughout all of our lives. And that is something we will continue to be Black and navigate healthcare. And that's, I think, one of the really key contributions of this conversation, right? That we're all going to leave with something just a little bit better to go out there in the world and also share it with others.
Yes. Thank you so much, Sophie. I now want to hear from each and every one of you that is still left here today. How are you guys showing up for yourself? How are you advocating for yourself? How are you honoring your body? Let us know. There's some things that I do currently, and I can share this, and I would hope this is something that you can maybe, put into your rituals or your practice. But when you're starting your cycle, see how your body reacts to the environment and everything around you. I keep a little period journal, I'm not gonna lie. So I know when I'm ovulating, and I know how I'm feeling, and I know how I react to things, and I know what triggers me, because I'm starting to realize, and I'm not sure if you guys are familiar with Queen Afua and Sacred Woman, but that is Bible for me. Before I even stepped into an OBGYN, that book kind of helped me holistically heal myself from things I was Googling for a very long time in college. And I've always had an issue or weird situations with my GYNs. So the name of the book is Sacred Woman by Queen Afua. And because of her practices, and I have a lot of friends that are actually in this chat right now, who is my biggest support group. And we do rituals around like the moon, and we really talk to each other in our feelings, and we talk it out like what's happening, because those experiences literally lead up to why you may be infertile or you're not fertile or whatever the case is. So I really want you guys to pay attention to what's happening in those moments. But I would love to hear from you guys to see, what your experience is with that. Anyone? Don't be Bye. Safe space. Anyone? Andrea, Gab, I'm calling out all my friends now. Okay, so if we don't have any questions, I'll check the chat. It is safe to say we are wrapping up this event. I really hope you guys get to leave with something that is so important to you and that you will take that leap of faith and swallow your fear and really, stand up for yourself. It is important. And then you also want to bring your brown and black sister and even your allies. Like, let's not just make this about, I mean, it is just about us in this moment, but you won't know what's happening if you don't ask every single woman, right? So don't be afraid. Like, I really want, because Kind Body is a representation of, like, we see everyone and we feel everyone. So even though we're holding spaces like this, ask your white friends, what's up, what's going on, how are they advocating for black and brown bodies, like what are they doing? And then you're going to come into the clinic and think, what would Rihanna and Beyonce do? That's my goal. Okay, and I just make sure I get everything I need said and done. And now more than ever, especially in these sensitive times, I've been standing up for myself. And I'm so proud, and I've seen the health and the transition within my body since I've been working here at Kind Body. And I'm taking those measures. Like I said, I've learned that I've had slight PCOS. So now I'm meeting with a nutritionist because now I need to figure out what are the imbalances in my diet or in my health, because I don't have any kids, but I would like one. And for a really long time, I thought I was infertile because at 16, I had a very weird abortion and I thought it was me. And then my GYN was just like, well, what if it's your partner? So as I'm getting older and I'm about to be 30, I'm realizing the importance of knowing what and how to take care of our bodies from all ends and all aspects. So I really hope you guys enjoyed this conversation. Thank you to the moderators, the host, and the panel. I couldn't be here without you guys. Thank you for everything and your time. To the amazing audience, I love you. I will support you and advocate you to the day I die. Please email, contact us, anything. We are here for you. And yes, rest, take care of your body. Black women, we are it, okay? We've been it, always will be it, period, okay? Alrighty. Thank you so much, everyone.
Thank you. Everyone have a great night.
Thank you. Have a good night.
All right.